Welcome to CRHS Health Talks. My name is Stephanie Miller, and I'm the Physician and Community Outreach Coordinator for Columbus Regional Healthcare System. Today, we will continue our conversation on COVID 19, focusing on wellness. Will our two guests please introduce yourselves?
Hi, everyone. I'm Jamie Losey, licensed clinical social worker. I work in the Denary Cancer Care Center, Southeast Pediatric, and also the Surgical Weight Loss Center.
Thanks, Jamie.
Hey everyone, I'm Jeremy Simmons. I am the chaplain here with the Manager of Spiritual Care and also the chair of the Diversity and Inclusion Council. So glad that we're able to take part in this conversation as COVID has affected many of us in this community.
Thank you two for being with us today. We'll go ahead and jump into the questions. So, I'll pose this to both of you. How has the current COVID 19 pandemic affected people personally and professionally? What are you guys seeing?
Sure. Really unique and challenging about all this is that everyone has been affected in some way by the pandemic. So even if we haven't been diagnosed or don't have a close family member, we've all still been affected. How it changes our daily routines, how we're taking on new roles like being caregivers or teachers to kids at home. It's just such a challenge to adjust to the new roles, the new routines, managing responsibilities, and it's just created a lot of stress, a lot of overwhelmed feelings, a lot of anxiety. I think that we're all feeling on some sort of.
Yeah, I mean, it's disrupted our sense of normalcy. People have had to deal with all types of heavy things such as death, unexpected illnesses. Many people have lost their jobs, and even our children. I think about my kids, like my children, their just experiences have been changed. So I just think about how patients in the hospital, when the virus initially hit, and visitors were not coming into the hospital, and just how that affected, the patients here. When you're going through any type of illness, one of the worst things that you don't want to happen is to actually have to go through it alone. So when we didn't have visitors coming into the hospital, it was just kind of challenging watching our patients having to kind of endure just the hospital stay on their own. So I mean, people
What are
feel
some of the
isolated.
common, sorry,
Uh,
yes, what are some of the common emotions that you're seeing people express as we're going through this pandemic?
Yeah, I think we've all felt anxiety, stress, depression, loneliness, frustration, anger since all of this started. And I know I've had to become okay with feeling those, recognizing that they're pretty normal for right now, too, with everything that we're going through. And Jeremy, I know that you spoke to a lot just now, too, about what people are feeling as well.
I definitely, I mean, everything you said, I've seen people experience a lot of anger as well. If you think about the whole idea of wearing a mask and not wearing a mask, you walking out in the public, see people mad at each other for something as simple as that. Then
Mhm.
also just the whole feeling of grief, like just with losing almost everything. Seeing a lot of grief being played out here as well.
Yeah, and I think all those feelings, like you said, about things that seem so simple, it's because we have all these feelings related to an overarching, I don't know, fear, I guess, and like loss of control and loss of that normalcy, like you talked about. It's just so, and I think that's why I try and talk to people about, okay, so what are you feeling? Like trying to figure that out and know what common things look like. Like, stress, depression, anxiety can all look like trouble sleeping, feeling sick to your stomach, having pressure on your chest, sadness. I mean, there's so many common feelings that go along with these overarching emotions that you have to figure out what you're feeling to know how to cope with them. So,
Absolutely.
yeah.
Speaking of coping, what are some healthy ways that people can deal with these emotions and cope with what they're going through?
Yeah, I think there's, a lot of different things. I try and stay connected with others, make phone calls, reach out, FaceTime, send letters. I mean, whatever you can to reach out and feel that connection with people. Also, I've just been really amazed at how technology has been really helpful with churches, having online services that you can join in with that are local. Mental health therapy and telehealth has really so that's something that you can easily reach out to. Almost all of the mental health agencies around here, I think, take self-referrals. So I don't even know that you have to have a doctor say, yeah, let me send this in referral. I think if you call them, they'll get you connected with who you need to talk to. If you don't have someone that you're comfortable with talking about emotions, you can, if you have internet, if you have a phone, you can talk with a therapist. So that's something to, and just finding hobbies that you enjoy, taking time to do things that make you feel calm, make you feel happy. So it might be music or sewing or watching TV, gardening. Definitely don't feel guilty about when you need to take time for yourself.
Can I add this to what Jamie said? I agree with everything she's saying. I know we all cope differently. And
Mm-hmm.
us having a lot of time on our hand, I just keep thinking about all of the underlying issues that are behind COVID-19 as well. And I just think about how exercise could be a healthy way that we all can
Mhm.
just get outside and walk for 30 minutes. It
Mm-hmm.
can kind of help you kind of relax your mind, but it also helps your body. And it helps us actually fight against COVID-19.
Mm-hmm. Absolutely.
That's good.
The other day that just 10 minutes of stretching can have effects on your mental health, your physical. All do, it's just stretch or take a few steps outside, walk around the house, whatever you can do. That one, Jeremy.
Right. Thanks, guys. Um, how can our community come together and be there for one another during this and times when people, like you said, are getting angry at one another for mask wearing or whatever? How can we come together?
So, Stephanie, my experience being, I've been here for 4 years now, and I think this is one of the things that Columbus County does very well. We are known to come together, especially in tough times. I just think about those two hurricanes that's happened within the last 2 or 3 years, and how people on the ground just think about community CPR, the Dream Center. It's how all these nonprofit organizations came together and worked together to make sure that our people were taken care of. So I think
Hmm.
that we just need to keep that at the forefront of our minds that we do this well. Um, Presence is one of the main things that people need in this time. So um, although we're encouraging people to kind of socially distance and stay 6 feet away, you still can be present by making a phone call and just kind of checking in on them. If somebody needs food, you might be aware of it. You got these organizations that are here that can just go drop food off at the front doorstep. But we do this well, so let's just tap into what we are used to doing, so that we can make sure that our people are taken care of.
I agree. Thank
Mm-hmm.
you, Jeremy. So, what are some resources that you would suggest to people who are having trouble, who are struggling with stress and the fears, and maybe they just can't shake it and they don't know what to do? Where can they go for help, or who can they call? What can they do?
So being here as well, I've realized that this is a very spiritual community. So I would tap into my spiritual resources. Reach out to your pastors. Your pastors are actually thinking about you, praying about you. I meet with them once every month, as many of as possible. But reach out to your pastors because they just want to make sure that their people are taken care of as well. There's also other mental health resources such as Trillium. Trillium is an organization that can help with mental health challenges. So if you are having these ideas of causing harm to yourself or just don't feel well mentally, that's a resource that you can kind of tap into as well.
How can they contact Trillium? Or,
I know the website has an information line and a crisis line.
okay.
Um, so
Can you
yeah, I would.
spell Trillium for us?
Yeah, TRILLIUM. Is that right, Jeremy?
That's correct.
Thank you, guys. Okay. So someone can just Google Trillium and
Yep.
get to their website. Okay. And there's a crisis line there. That's good to know. Thank you.
So,
Okay. Anything
And they
else?
will connect you to people to talk to as well.
Okay. Very good. Anything else?
and of course, the hospital is a resource. I think this is one of the safest places in this community.
Hmm.
So if you feel like you need help, feel like physically you're sick, hospital is a safe place to come to. So please come here and get
Right.
the care that you need.
Right.
Yeah.
Don't delay in your health. If you need
Mhm.
help, if you need care, come to the hospital. Exactly. Well, thank you guys so much for being with us today and talking about this very important topic that I think it's touched everyone in America, you know, some way or another. So thank you so much. And we look forward to you joining our next edition of Health Talks. Have a great day.
Thank
Take care.
you.